I need every American to do their part. And that's not hyperbole. I need you. I need you to get vaccinated when it's your turn and when you can find an opportunity. And to help your family, your friends, your neighbors get vaccinated as well.
Well, that was President Biden last night making a direct appeal to Americans to get inoculated against COVID-19. His comments come as a new Edelman Trust Barometer special report is measuring Americans' confidence in vaccines and trust in institutions. So let's bring in Richard Edelman now. He is the CEO of the company behind this report. You know, I love talking to you because I think what you guys do is just so fascinating to me, the way you tap into our trust level. Normally it's just once a year, but you've done a special report marking kind of the 1 year of being in the middle of this pandemic. So I want to ask you about vaccines first off. You found that overall 72% of U.S. adults believe the available vaccines are safe and effective. It's pretty high. How does that number, though, break down across different demographics that you surveyed?
So first, it's a bit of a political issue. Much higher confidence in vaccination among Biden voters, 80 versus Trump voters in the 50s. Also, interesting break for gender. More confidence by men in the low 70s, women in the high 50s. Also, interestingly, by geography. Higher confidence in the Northeast and in the West and in the middle of the country. And it's very important, though, to understand that people don't want to be ordered to take the vaccine by their employer. 70% told us, don't make us, educate us, enable us. And also, Emery, very important, this whole idea that African Americans and Hispanics have deep vaccine hesitancy because of fear, it's not so. They don't have access. 43% of both of those groups said, I can't get through on the software. I need appointments. Give me the chance to get the vaccine.
That is so fascinating because we've spent a lot of time talking about that issue here on CBSN, and I've often felt that more of the conversation has to be about access as well. We know that even before the pandemic, getting access to proper health care was challenging for some certain demographics, I want to grab your report and like bring it down to the CDC or something. So let's talk a little bit more about the disparities when it comes to vaccine access. What can you tell us about those numbers?
Look, I think part of the problem is also around education. And, nearly a third of people told us that they don't feel that they have enough information to make the decision to get the vaccine. That's a miss by society. And who do they trust? They don't trust mainstream media, except for CBS. They trust the CDC. They also trust their employer, and they trust their doctor. So we've got to get MDs all over the country to be pushing quietly for their patients to get the jab. It's urgent at the moment, and President Biden was so good last night in just explaining that do it for your neighbor, do it for your grandma. It's not about you; it's about everybody.
Clearly, you are a man in demand because someone's trying to get through to you right now, but they cannot have you because we still have some more questions. You also asked people about whether or not they're still in a pandemic mindset. How do you define that, and what was the result of that question?
Well, 2/3 of people told us that they're in a pandemic survival mode. And why is that? Well, imagine half the people in the study said that they know someone who's died or someone who's in the hospital. Beyond that, 1/3 of the people told us that they've either lost their job or had a significant reduction in their income levels. So we're really traumatized as a country, and it's going to take a while to get out of this. And you and I both live in New York. Only 15% of people said that they're prepared to take a train or the subway. And beyond that, we find that only 20% are willing to take an airplane flight, 25% are willing to go see grandma. So again, this massive number of people who've died has had a significant effect on society.
I think that's really fast. I actually work in New York, but do not live there. So I would be one of those people that, has to think about whether or not I'm ready to get back on public transportation and how comfortable I feel about it. There are so many things that have changed that I find uncomfortable now. Sometimes, you watch video or stories from just maybe over a year ago and you see people crammed together in a small place, and immediately I start to sort of feel itchy because it looks so dangerous now, so much more dangerous than it ever did before. Your company released a report in January which found that people around the world had a really sort of low trust level when it came to government officials, journalists, you pointed out mainstream media, business leaders. How does that level of trust that you see in the survey compare to what you saw with that previous survey, which is sort of your big yearly report?
So it confirms that, in fact, the most trusted institution is my employer, that trust has gone local.
Wow.
It's in people near me. I feel that I can control that relationship, that, in fact, I actually get the highest quality information from my company's newsletter, more than mainstream media, more than government. I also get good information from my doctor, not from global health organizations. So I'm skeptical of information, in part because of social media, and in part because I've heard so many mistruths over the last year. And so my reaction is, again, I can trust things I can see and people I know. Other than that, we're in a place where people will freeze because they can't get adequate information. And that is the urgent need in the next couple of months. If you're an employer, you've got to talk frequently. So our data shows employees want every week to get an update on the progress on the pandemic, where they can get vaccinated. What about return to work? And they don't want to be ordered. They want to be educated and given a choice. 60% of people said, I will return to work when I'm ready. I'm happy to work from home. And that's a big signal for business in particular. If business is the most trusted institution, which it is, then CEOs and people in health departments at the companies have to give that quality of information to their employees. That's an obligation.
That's really fascinating, but I suppose it makes sense in this period of social distancing where we have been physically away from each other. The individuals that we trust the most are the ones that we have an intimate connection with, and so it's sort of paramount that they give us the most accurate information. Richard Edelman, it's always great talking to you.
I also hope business takes the opportunity to not just go back to normal, that we take a new normal, that we in business take on systemic racism, sustainability, the right level of wages, how we get to work, and somewhat remote or sometimes at the office. We have to really reimagine a future that is recognizing that we've been through a deep trauma.
Yeah, that's such an important point. I know we spent a lot of time here sort of focused things specifically directed to the pandemic, the vaccines and so on and so forth. But you're right, this period of social distancing and wearing a mask has also given rise to conversations about some really sensitive topics that we had not talked about before, really open conversations. And there has been a shift in many areas of life. And I think that people will reject going back to whatever was happening before. What people want to call normal was not so great for everyone. So perhaps there will be a new normal emerging out of this. Richard Edelman, once again, great talking to you. Thank you.
Thanks for having me.